people. I want to check in with Ed. What's the word on social media?
You know, a lot of people are surprised by the numbers and what the conversation we're having tonight. But you know, there's been some discussion, a few people bringing up, where do the pharmaceutical companies play a role in this, and where do the actual doctors who are writing these prescriptions, where do they play a role?
Okay, we don't have the pharmaceutical company here at the table, but we do have a doctor. Where do the doctors play a role?
Okay, so this doctor can report that probably twice in the past month, I've had a pharmaceutical representative stop me in the hallway between patients to try to sell me a form of a narcotic medicine and to promote the use and to educate me about the use of that medicine. I'm usually not interested in being educated by someone from that vantage point, but the promotion directly to doctors exists.
And what else should doctors be doing? Anything else, in your opinion?
So many things. So one of the problems is doctor shopping, or we sometimes call it multi-sourcing, where a patient will come in and ask for a prescription, and then they can go to another doctor and ask for another controlled prescription. And currently, in our state, we have no process to stop that or to create an alert that would in fact enhance that patient's safety.
No tracking system.
There's no tracking system, and my colleagues can speak to that as well.
Right now, Missouri is the only state in the entire United States that does not have a prescription drug monitoring program. Everyone here is nodding their heads, they already know this, but we really want the people at home to know this. We've had it brought up in legislative sessions the past few years, and it has been shot down the past few years. So we really want to call on the people watching this show to ask their legislators to look into this and get this thing passed, because we need it, because it saves lives.
I know some of the pushback, and I won't be able to represent it entirely accurately, and we can move on to the next topic, but some of that pushback has been that this is targeting the wrong end of this problem in terms of you're not tracking the person, you're tracking the doctor that's writing the prescription.
You can actually, I mean, the goal of that program is that, you know, this is very painful for a doctor. I mean, you can call it the art of medicine, or you can call it just a mess of balancing competing interests where you have pain that needs to be treated and you want to prevent addiction. And so doctors need as many tools as possible. And this is one of the tools where a doctor can look up a particular patient and see every prescription that patient has received from every doctor in the state for the patient's safety.
Okay, thank you, doctor. Okay, so also the graphics, I want to go back to that we just saw there for a second ago. 3 out of 4 overdoses deaths are caused by prescription painkillers. Does that resonate with you?
Yes, it does. It's about 15,000 a year currently in the United States. By far the largest cause of overdose death out of all the others: cocaine, heroin, amphetamines, barbiturates, painkillers. That's where it's at.
The other stat was that essentially saying that most of the folks get their prescription medications that they are abusing for free. They're getting them from someone they know. Does that resonate as well? Does
That's
that ring
exactly
true?
right. I mean, people, by and large, are not going to the street and buying these drugs. They're walking in the bathroom, taking them from mom and dad's medicine cabinet, going to grandma or grandpa's, going to a friend's, going to a neighbor's. They're getting it from someone they know. All the research and all the anecdotal evidence points to this. And that's why we really need to educate people to let them know, don't just leave it laying around. Dispose of it, lock it up. These things are dangerous. We cannot just leave them there.
And it should be no surprise that there's so much availability of it, because the hydrocodone alone, 130 million prescriptions a year in the United States. There's 310 million people. So we're talking about there's enough prescriptions to serve half of the population. And when you break it down by the numbers, it's been said that there are enough pills that are prescribed, just this one drug, one of many, to medicate around the clock every adult in the entire country for a month nonstop. That's terrible.
I don't want to pick on the doctor again, but I want to go back to the Affordable Care Act for just a second. Anything else that you see coming down the road that could have an impact on this topic that we're talking about tonight, this problem of prescription drug abuse that might be affected by the changes in the law?
So the best way to avoid prescription drug abuse is to use non-drug solutions for patients who are suffering. And non-drug solutions take time and they're expensive, but they pay off in the end. So again, access to specialty services, access to physical therapy, access to counseling, access to learning about mindfulness and biofeedback, because treating pain is not completely treated by a pill. It always requires a multifaceted approach.
So fewer pills in the system, if you will, in circulation.
Yeah.
And many of the doctors need trainings. I was just speaking with Heidi about this a moment ago, or Nicole, I'm sorry. Many doctors do not receive training in their medical schools about this issue. They are taught that these things will not become addictive early on. They're not just now realizing that they can become addictive. And so unless the doctors know about this issue, they're going to continue to do things like we've heard, prescribing 30-day supply of Vicodin for a sprained ankle. Someone has a wisdom tooth pulled out and they get a 90-day supply. These things are happening right now. And then all those extra painkillers are just sitting there in the medicine cabinet waiting to be abused.
Jude, I cut you off there for a second.
No, I was just going to say that's exactly how it started. You know, my mom, I think she had some kind of surgery, and she had, you know, she was one of the kind of people only take a few, and she left like a whole bottle of them, and I just started taking them. And that was, after marijuana, that was the second drug I'd ever tried.
I think we have time for one last word from the doctor.
Well, 7 years of medical training. I probably had an hour training in addiction medicine. It needs to be incorporated into medical education.
Okay, we'll leave it.